All right. I'm now going to declare the hearing, the Board of Health hearing on the 2022 state sales regulation of tobacco and vape products open. I'm Lisa Whittemore, Chair of the Board of Health.
I'm Rick Jacobs, Vice Chair.
Sean McAuliffe, Health Director.
And Nadia Roberti, Administrative Assistant.
We may be joined by the third member of Board of Health virtually, and if that happens, I will stop and introduce her, right? So the first order of business is I will read the notice of public hearing. As required by Massachusetts General Law, Chapter 111, Section 31, notice is hereby given that the Hopkinton Board of Health will hold a public hearing on Tuesday, April 18, 2023, starting at 6 p.m. and ending at 6:30 p.m. at the Hopkinton Senior Center, main room, handicapped accessible, 28 Mayhew Street, Hopkinton, Mass., to hear, accept comments, and to consider adoption of the 2022 state sales regulation of tobacco and vape products. Copies of the regulations are available at the Health Department and the town's webpage. Written comments may be mailed prior to the hearing to the Health Department, Town Hall, 18 Main Street, 3rd floor, Hopkinton, Mass. 01748. This legal notice is also posted on the Massachusetts Newspaper Publishers Association website. So the purpose and the order of the conduct of the hearing will be as follows. The purpose of the meeting is for us to receive input from citizens. The order of the proceedings is we will briefly review the regulations and why we are contemplating these changes in regulations. We will then hear comments from those in support or in opposition of any of those regulations. Additional comments that are not repetitive, board discussion, announcement of the board's decision, if any, and then motion for continuance or closing and adjournment. So that's how this evening's proceedings will be run. The reason, there are two big reasons for doing this. One was to ensure that our local regulations are now in alignment with the Commonwealth of Massachusetts tobacco regulations. And so we needed to make some changes to our regulations so that they mirrored what the state asked for. So just very briefly, we're going to adopt some definitions. I'll just run through them. Blunt wrap is any product that's made wholly or in part from a tobacco product, and it's manufactured or packaged with loose and removable leaves. Tobacco leaves are like in such kits as roll your own packages. Rolling papers are papers that do not contain tobacco, and a rolling paper with a characterizing flavor shall be considered a tobacco product flavor enhancer. So, the regulations that we are meeting tonight around adoption include a tobacco product sales permit will not be renewed if the permit holder has sold a tobacco product to a person under the age of 21 3 times within the previous permit year, and the time period to appeal has expired. The violator may request a hearing in accordance with subsection 4 of the violations. As of the effective date of this regulation, any permit surrendered, revoked, or not renewed, either because a retailer no longer sells tobacco products as defined herein, or because a retailer closes the retail business, shall be returned. The permit shall be returned to the Hopkinton Board of Health and shall be permanently retired by the Board of Health, and the total allowable number of tobacco product sales permits under paragraph A shall be reduced by the number of the retired permits. The only way a new retailer would be able to have a tobacco license in Hopkinton would be to buy an existing business. this actually is not new. We adopted the cap and the sunsetting clause during our last regulatory period in 2018, I believe, or 19. The state requires that we say that we will not issue any new applicant a permit, a retail location within 500 feet of a public or private elementary or secondary school. Hopkinton doesn't have any retailers within that period of time, but the state requires that we put it into our regulation. A tobacco product sales permit shall not be issued to any new applicant for a retail location within 500 feet of a retailer with a valid tobacco product sales permit as measured by a straight line. This bars new retails from selling tobacco near an existing tobacco permit holder, regardless of the cap policy. Applicants who purchase or acquire an existing business that holds a valid tobacco product sales permit at the time of the sale or acquisition of said business may acquire said permit providing the applicant submits a valid application and meets all conditions within this regulation within 60 days. Permits for adult-only retail tobacco stores will only be issued if one is available pursuant to Section 10C above. So we still have the cap, but there is a 60-day process for someone to apply, correct?
And then the adult, based on my understanding, the adult locations would be within the 500-foot barrier.
Right.
So we wouldn't be allowed.
Another provision is smoking bars are would be prohibited in Hopkinton, Mass. No person shall sell or distribute or cause to be sold or distributed a single cigar unless such cigar is priced for retail sale at $2.90 or more. And that price is recommended by the Massachusetts Department of Public Health and the Commonwealth. No person shall sell or distribute or cause to be sold or distributed any original factory-wrapped package of 2 or more cigars unless such packaging is priced for retail sale at $5.80 or more. And that, again, is a recommendation by the Mass Department of Public Health and the Commonwealth. No person or entity shall sell or distribute blunt wraps in town. All non-residential roll-your-own machines are prohibited, and we have a bylaw in town that prevents the sale of tobacco papers. No educational institution located in Hopkinton shall sell or cause to be sold tobacco products as defined herein. This includes all educational institutions as well as any retail. And in the case of a first violation, a fine of $1,000 shall be issued, and additionally, if the violation is a sale of a tobacco product to a person under the age of 21, the tobacco product sales permit shall be suspended per 105 CMR 040D for 3 days. And that was our decision to say for 3 days for a first violation. So those are the changes. That's a lot, I know, in recommendations. We're doing this for a lot of reasons. One is we really want to monitor the tobacco sales in town. We want to make sure that our youth are protected and don't begin to use tobacco sales, so we're trying to be very careful about that as well. We have been very successful with a vaping program that Sean has instituted in the high schools, and we are seeing electronic vaping drop in our youth. And our goal is to reduce the incidence of tobacco in Hopkinton, and particularly among the youth. So at this point, I will open the hearing to anyone who has any comments or questions. Any comments or questions? And No. Any comments or questions? We will keep the hearing open until 6:30. Regardless, oh wait, it's got to be Regina, I'm sorry. No, I don't think so. I'm sorry about this.
We're waiting for the third board member to join. We have a quorum nonetheless.
Yeah. Oh, no, it's not her. Sorry. It was a Hopkinton number, so that's why I picked it up. So any comments or questions from you? Do you want to talk a little bit, since we have some time, about the adolescent health survey results, Sean?
So a lot of our programming
No?
in the community is based on the results of the...
As it relates to this hearing. So
Right.
not broad.
No,
Narrow.
keep it. So a lot of the work that we do in the department is based on the results of the Metro West Adolescent Health Survey report. The last published report for Hopkinton was completed in 2021, and as the chair had noted, we had implemented a vaping reduction program that got expanded to all tobacco and substance use. And over that time period from 2017, really 2018, it really got going to present, we've seen a significant reduction in the use of electronic vaping products. So from 2014 to 2021, the lifetime use in the high schools has dropped from approximately 40%, so that's 40% of roughly 1,100 students, to approximately 19%. We've seen a reduction in the current use of product from 20% in 2014 to approximately 13% in 2021. And our hope is that we continue this reduction in the use of tobacco products in the community. And one of our focuses moving forward will be on reducing the rate of tobacco use in high school females, because this is the first time in the adolescent health survey that we saw female use in high school students above that of male use. So the current lifetime use in females in 2021 was 21%, and males was 16%. So we want to look at that and see what we can do to further reduce the rate of smoking in the female population in the high school. And yeah, that's really it.
Any comments, questions, concerns, more information?
I mean, I could add that in general, Hopkinton's tobacco use is below that of the average use throughout the Metro West region. And a lot of that.
All ages?
Yes. So we've done a good job with our vaping and tobacco education programs.
And we currently have how many retailers who sell tobacco products?
So, we had eight.
Eight,
Yeah,
that's what I think, yeah.
We were at
11?
11 when I started. So,
So the sunset clause is working.
yes.
So when I ran for this office the first time, the tobacco was on my mind, because COVID hadn't come yet.
COVID, yeah, right.
So this is really important to me to see this being in this hearing tonight.
It's nice to do something other than COVID.
But one of the studies that we're looking at is whether the COVID outcomes among smokers was worse than that for non-smokers. So we just haven't had time to tease that data out.
In Hopkins
In
specific.
Hopkinton, yeah. That's probably an upcoming internship program that we'll launch.
Interesting.
So,
So one of the things that we've changed in Hopkinton about the way we are monitoring tobacco, and particularly the way we are monitoring sales to individuals under 21, is we're partnering
right.
with other towns across the Metro West region, and they hire people who look and are younger than 21 to go in and attempt to purchase.
Right.
And when we first started this partnership, we had a one or two incidents of someone selling to an individual under 21, but in the last several years that we've been doing it, we have not had any incidents, which is really nice. And it's great that we don't have to monitor it from our local health department, but that we can partner with other cities and towns in the Metro West
Right.
region.
It's grant funded
Yeah.
through the state. It's expanding. We focus on educating the retailers. That's the priority, is that we educate them, we provide them the resources so that they can comply, and then we verify through typically two compliance inspections a year. And again, our retailers have been performing or outperforming those that are part of our regional program. So, yeah. Do you have any questions?
So we have to stay open until 6:30 because that's how we called the public hearing. And at about 6:28, we will probably take a recommendation from the board and then close the hearing promptly at 6:30.
Can I ask a question?
Yes.
So I'm wondering, do you observe how these types of products are promoted to the different age groups in this community? And do you have any
So we,
that?
It's a great question.
yes, so
Want him to-
I came from,
Excuse me.
Oh.
Can you, just for the record, identify yourself?
Jim Cousins from HCAM.
Thank you.
So I came from the retail sector prior to coming to Hopkinton, and I work with Youth and Family Services and the school district to discuss what they call planograms and the use of planograms. So all of the product that you see at a convenience store, supermarket counter, that's all choreographed. And they specify the number of products, the location that the products are supposed to be placed in. And a lot of that has to do with visual sight lines by age group. You notice that the candy tends to be at kids level, like your knee level, but that's easily accessible to kids. And through efforts with the DPH, the CDC, we've developed programs to educate people about how this is used, and then it drives some of the regulatory work that's being done. So why certain products have to be held behind the counter or behind a display, how certain signage has to be prominent on the health hazards, the sales requirement, and then how certain advertising has to be set off behind the display. So it's an ongoing and evolving process where they come up with different marketing techniques and strategies, and then the state responds with revised regulations. So it's a fascinating science. But we've held classes with Hopkinton high school students and middle school students, and taken them through different marketplaces to help educate them about why things are placed where they are. And as I said, it's a science. It's why you walk through a store typically right to left. It's why the milk and eggs are always in the opposite corner from the produce department. And then, yeah, so.
One more?
Sure.
Sure.
Thanks. I'm curious, are your guidelines following the state? Are they more stringent than the state? And how often does something like this happen where you're aligning your local stuff with the state?
I'll take a first stab, and then I'm going to let Sean. Much of what is in this regulation is prescribed by the state. So we wanted to make sure we were up to date. There were a few decision points which I highlighted. One was we could have, for first violation for selling to 21 or under, I believe, has suspended the license for up to 30 days. We chose for first violation 3 days. We also were able to, I believe, set the fine for the first violation.
No, the fine was set.
The fine was set, okay.
Right, was the duration.
So when DPH updates their regulation, we do have to go in and ensure that we are minimally where they are. We can usually go beyond,
Right.
unless they explicitly say, this is where it is. Is that
Right.
fair?
Right, that is fair. And generally speaking, we have some consultation with the business owners, some consultation with Youth and Family Services, the schools, to help inform our decision. But for the most part, we try to align ourselves with the state minimums, because that's the standard that we're held to.
So when the state banned the sale of flavored and menthol cigarettes. So we revised our regulations then to make sure that they were in line with what the state did. We could have gone out in front and said we're not going to sell flavored cigarettes, but in consultation with our business partners, what we knew was that we knew the state was about to do that, and rather than disadvantaging a small number of Hopkinton businesses, we decided to wait a few months,
Right.
and then align ourselves with the state.
Right. And we've also, with respect to sunsetting, we had an option not to sunset.
Right.
But knowing that we were going to likely be awarded the Drug Free America grant, we wanted to align our tobacco policies with the grant and grant requirements. So we proceeded to adopt the sunsetting requirement. And in the communities in this region that have or had adopted sunsetting, they've seen a reduction in tobacco use in the schools. So.
And we do allow, if a business is being sold, we allow them to retain that license.
Right.
It's just if they terminate the license and then sell the business, they would not be able to apply for a new one. It's a balance.
Yeah.
Now, you mentioned that, for example, when the state bans something, you will update your policies to ban something. What is the purpose of that? If the state bans it, what's the value of Hopkinton also banning it?
To avoid confusion. So it's, and that's why we work regionally also, so that across the board, we all have a generally speaking, a consistent set of regulations that our field inspectors will hold the retail salespeople to. So it makes regulation and interpretation and compliance easier if there's a single set of rules. And I think across the region, there are towns and cities that haven't adopted sunsetting, but that tends to be the one variation.
So question for my fellow board member is, we can, as of tonight, we can ask for additional information. We can make a motion that we are approving these and approve these new regulations tonight. We can continue the hearing if we wanted to do this again. So my question to you is, how do you want to move forward tonight?
I think we should decide tonight.
Okay. So
You agree?
I do. And what's your recommendation? Can you make a motion?
Sure. I make a motion that we accept the changes per what Sean described, and they become enforceable after this.
And go ahead.
Excuse me.
Yeah.
If you can just say except 2022, the heading.
So say the heading, except the
yes.
2022, yeah, that would help.
Thank you. That wasn't, I didn't see it in front of
This
me.
is that's what you want to say, 2022. With an effective date. We're using up time. 20, the motion to adopt.
Right. Okay. Yeah, okay. I'd like to make a motion to adopt the 2022 state sales regulation of tobacco and vape products effective tonight? Today? Tomorrow.
Business tomorrow. And the date is April
19th. Effective April 19th.
Oh, of tomorrow?
That's it. That's tomorrow.
Oh, yeah, sorry. I'm thinking it's the 14th. So.
And I will second that motion. And then, because this is a public hearing, we have to have, you approve?
I approve.
And I approve.
Thank you.
And
Anyone who wants copies?
and there are copies of everything that we talked about here, and I am going to take a motion to,
Motion to end the meeting.
and I second that.
Thank you.
All right.
Should us adjourn at 6:29?
The hearing is adjourned. Thanks, Jim.
Thank you.
Thank you.
Thank you.